I am Bart Gordts. I was trained as a clinical microbiologist and infection control physician in Belgium, and I spent my entire career working in this job, mostly in the microbiology lab and in the Department of Prevention of Nosocomial Infections. Of course, artificial intelligence and information technology in general is a very hot topic in microbiology laboratories since at least a decade. I think in order to get our ideas straight about this complicated topic, we need to make the difference between plain information technology without artificial intelligence, and then artificial intelligence in itself. And then, of course, the combination of both, because the future will definitely consist of this combination. The digitalization, which is the word that I use for IT without AI, is, of course, the basis for the automation of repetitive tasks in the laboratory. And we all know that it manifestly increases the speed, it improves the quality, and therefore the effectiveness of the laboratory. So the digitalization is, of course, essential for the lab robotization. But we must be aware of the fact that IT in itself can also manage complex decisions based upon the many data collected without artificial intelligence. And these decisions can influence the production process, especially in automated laboratories. And therefore, it can definitely improve the outcome for the patient. AI and machine learning, on the other hand, differ in the fact that they manipulate huge databases, large data sets, not only from a given laboratory, but large data sets from networks of laboratories, which might be all over the world. And moreover, they can take into account data sets that do not originate from the microbiology laboratories in itself, but from clinical databases, from demographic databases, even from social and geographic databases. And when artificial intelligence puts all these data sets together, and then with the use of machine learning and artificial intelligence, you can, of course, start to rethink the whole production process of a microbiology laboratory. And then finally, the combination of both, on one hand, digitalization and IT, and on the other hand, artificial intelligence, will be, in my humble opinion, the keystone for large automated laboratories, because they will be able to have these systems influence their production process and rendering the production process more efficient, but also much more accurate, and in the end influence the outcome for the patient and improve the final medical quality. Well, there is this important topic about automation and artificial intelligence and IT in general, and rendering the difficult task of screening samples more efficient. The first step, of course, is full automation. Full automation of the microbiology lab enables mass screening at low cost and at high accuracy, like, for instance, the screening of MDRO status of many patients. With an automated laboratory, you can screen every patient in the hospital, coming in the hospital and leaving the hospital, and get a complete picture of the MDRO status. But imagine what an artificial intelligence-driven decision tree could do. It could not only enable the screening process, but also make it much more precise, because based upon all the data that could be in the expert system, demographic data, patient data, networking data of other laboratories, an AI system could indicate for which patient in which situation at a given moment in time a screening for a certain type of bacteria could become possible or could become more indicated. And that would render the laboratory much more efficient, of course. And it could also, for instance, indicate in which situation more costly and ultra-rapid methods are indicated versus the classical screening methods that the laboratory is using. So in screening tests, I think AI can play a capital role. Just to give you an example of what might become possible by combining large data sets, not only from the laboratory, from the microbiology laboratory, but also from the patient's clinical records and the rest of the data that are available already now in data systems in hospital medicine. Imagine that you can combine the data sets from a patient who is admitted in intensive care, and that the AI-driven expert system is aware not only of the name of the patient or the age, but also of the daily temperature, on how long he has been in the intensive care ward, which type of catheter is in his veins and in his arteria, how long these catheters have been there, by whom they have been put in there, in the conditions in the operating room where the catheters have been placed, yes or no. Even taking into account the compliance with hand hygiene of the nurses in the given ward where the patient is admitted. If the temperature of the patient rises at a given moment, the decision by an artificial intelligence expert system to order a blood culture might be so much more easy and so much more accurate than when this decision is based upon the presence of a medical resident or an alerted nurse about the situation. I'm not claiming that these decisions will always replace, the AI decisions will always replace the medical decisions of the doctor being present, but it will definitely take away some mistakes that at the present time are sometimes taken because of the complex organization that, for instance, in an intensive care ward is present. So the possibilities are endless. But then when we specifically talk about artificial intelligence and information technology, I think that there's a whole new world opening up. Artificial intelligence, because of the possibility of manipulating and taking into account large data sets, are not limited to the data of the laboratory in itself. So it enables the possibility that even smaller laboratories could use the experience and the expertise of the artificial intelligence based upon data that come from networks of laboratories, which gives enormous possibility in improving quality and effectiveness of microbiological decision making. So I'm sincerely convinced that artificial intelligence will definitely reshuffle the whole organization of the microbiology laboratories, and not only even the diagnostic microbiology laboratories, but also the expert laboratories, the reference centers, who, thanks to artificial intelligence, will be able to work with all the data that are supplied by local laboratories. Today, a reference center who is responsible for surveillance of MDRO, multi-drug resistant organisms, is already gets a lot of help from IT, because IT enables the collection of antibiogram susceptibility data from a lot of laboratories in the region. Epidemiology and surveillance is already based upon IT for research labs at the moment. But imagine what artificial intelligence can do. When not only the AST, the susceptibility reports are taken into account, but also the patient demographics, the patient situation, the localization of the hospitals, the wards, the duration of admission of the patient in the hospital, whether the patient had catheters, was operated on in surgery, and so on. When all these data are interpreted in artificial intelligence expert systems, the reference centers could not only detect new MDRO types, but can immediately, at the same time, and almost automatically get a demographic picture of the distribution of this resistance pattern, but also of the risk factors, of the type of patients that get colonized or infected with it. Therefore, it can immediately make a judgment on the importance of this new aspect that they have discovered, and they can, on a more objective way, decide what the priorities of investigation and research should be about. So there again, it will render the context and the decision making completely different. I think there is almost a consensus that even the most sophisticated artificial intelligence expert system will never replace the judgment of a microbiologist. But let's be precise. Then I mean a good and expert microbiologist, because I'm convinced that the bulk of the routine work will be performed automatically with artificial intelligence. Each new development, you have what is called in the business life, it's called the early adopters versus the late followers. Let's not forget that medicine is a very conservative business, especially hospital medicine, because the organization is so complicated and it tends to continue the way it was. So changing behavior within the system in hospitals, more precisely in hospitals and altogether in microbiology laboratories in hospitals, is very difficult. And there I think I see a very important, let's name it a crucial role for the industry, because the industry can influence the behavior by sustaining and by teaching and education on how to deal with change in difficult organizations. It is really an essential step that cannot be neglected. About the question whether in the future there will be microbiology laboratories without artificial intelligence or even without information technology, but I think the answer to information technology is definitely no. I am convinced that there will remain a place for manual processing of samples, but it will be limited, in my opinion, to point-of-care situations. For instance, rapid screening for sexually transmitted diseases in a clinic, where basically the laboratory is only needed for supervision, for quality control, and so on, but not for the actual test. But the bulk of samples, the bulk of microbiology samples will be dealt with in large-scale automated laboratories, where not only the analytical, but also, I'm convinced of that, also the medical decision process will at least partially be managed by AI-driven systems. The big motivators for this change will be quality, the availability of services. And we know they are in a threat at the moment, and of course the budget, the economics will be the capital motivators for this evolution. There's no way around it. Biggest opportunities, I think that is a very difficult question because we are in a phase of research. So in my opinion, or in my eyes, it is not clear today what the next step in AI will be for the routine laboratory. There have been a lot of interesting research projects indicating plenty of opportunities. But in order to address this question, I would like to focus on not on what will be the next development, but in my opinion, what will be the immediate consequence of the introduction of AI. The consequence will be a shift in the concept and even in the reason to be of the microbiology laboratory. There will be a shift in focus and in organization. At the moment, most laboratories still work according to what is called a fee-for-service model. That means that the laboratory, in order to be efficient, wants or needs to process the largest possible number of samples for the lowest cost and at the highest speed possible. Artificial intelligence can enable the shift to what some call a value-based model, in which the lab focuses not on the quantity of samples, not on primary on the cost or the speed of the analysis, but on which test, at which time, in which situation will have the highest impact on the patient's outcome. This shift represents a fundamental change in the perspective of the lab itself, and not only for the lab, but the consequence will be a shift in the expectation and the use of the laboratories in the whole healthcare system. And that will influence the patients, it will influence the providers, and it will, at the end, largely influence the authorities in the judgment about how they should deal with healthcare.